Let's come back here to the capital and more specifically at Afia House, where the Ministry of Health has confirmed the recovery of the only case of M-Pox in the country. Health Cabinet Secretary Dr. Deborah Barasa further says those who could have come into contact with the patient were also traced and tested, with 29 of them turning negative, while 10 samples will undergo further testing. As the government heightens surveillance and rapid response, the Director General of Health, that is Dr. Patrick Amoth, says M-Pox vaccines will soon be shipped into the country.
The only confirmed case of M-Pox in the country, a 42-year-old Kenyan male and a long-distance truck driver, is now confirmed healed and discharged. He had travelled from Kampala in Uganda to Mombasa on the 12th of July and was en route Rwanda through Tanzania when he was detected at Taveta border point.
The only confirmed is one, and he has recovered. Okay, so we, as the DG has said, we have heightened surveillance.
Health Cabinet Secretary Dr. Deborah Barasa has called for caution, especially for long-distance travellers.
So we urge the public, especially those with a history of travel to countries reporting M-Pox cases, or those who have come into contact with a suspected case, to be vigilant. Even as the government say there is no other confirmed M-Pox case at the moment, screening and testing continues. The primary risk in contact with an infected person or contaminated personal items or through sexual contact is the common secondary infection that would occur in our country.
One is, once we receive the sample, we divide that same sample into 4. We give one to the CDC lab, we give one to the National Virology Lab, we give one to the Walter Reed Lab. So we'll only come up with a result that is confirmed once we have had collated results from all these labs.
And we have 26 suspects right now, samples. About 10 of them are already in the lab. And once the lab results are out, we will be able to communicate.
Dr. Patrick Amoth warned of the existing strain of M-Pox, stressing the need for sequencing.
This particular strain of M-Pox is called a clade 1B, which is more transmissible, and it is also more serious in terms of the disease pattern. So it's important for us to be able to sequence and know specifically the genetic composition of the variant that we are dealing with.
This crisis has piled pressure for vaccines.
Africa as a continent, we require 10 million doses of vaccines. We are assured by the Nordic manufacturer of the vaccine that by the end of the year we can be able to have about 2 million doses. But the vaccine will not be for everybody because of the scarcity in terms of the availability of the vaccines.
M-Pox has an incubation period of 5 to 14 days, but may vary from 1 to 21 days, which is the time from infection to appearance of symptoms, which include skin rash, mucosal lesions, fever, headache, muscle aches, back pain, fatigue, and swollen lymph nodes that last 2 to 4 weeks. While noting there are other diseases that appear like M-Pox, such as KBC and chickenpox, the government has advised the public to visit health facilities for proper review and adhere to required guidelines.
We have upped our diagnostic capacity. Remember, the platform used for testing M-Pox is the same platform that was used for COVID-19. It's called PCR, polymerase chain reaction. For now, we have dedicated 4 laboratories to be able to do this testing, but we have redundant capacity of more than 100 laboratories if there's need to be able to call for additional laboratory support.
Testing is being carried out at the National Public Health Laboratories in collaboration with partner institutions such as KEMRI. The public can report cases through hotline numbers 719 or 0729 471414 or 0732 353535. Serafina Robi for Prime Edition.